We're now being joined by Dr. J. Balachandran. He is a graduate from the University of Wisconsin School of Medicine and Public Health. He completed his residency in internal medicine at Northwestern Memorial Hospital, and he's the chair for hospital specialty medicine at Ascension Columbia St. Mary's, and he's one of Milwaukee's top doctors in pulmonary, critical care medicine, and sleep medicine. How are you, doctor?
I'm great. Thanks for having me.
I'm so happy to have you here with us. We know early in the pandemic, there was a media narrative that actually stated COVID-19 was the great equalizer because it was a virus that did not discriminate along class or color lines. However, that concept couldn't be more wrong. We realized very fast that COVID death rates of Black patients and certain other minority populations, including Native Americans and Latinos, were substantially higher than death rates of white and Asian Americans. So talk a little bit about where we are from that first narrative to where we are today.
Yeah, it's such an important question. The virus itself just wants to survive. The virus itself is going to want to put itself wherever it can and spread however it can. But I think the pandemic has reinforced the fact that every person's health is intertwined with the health of others in the community, and that there are racial and ethnic differences out there. And a lot of that has to do with systemic issues, systemic racism in particular. Inequities that are caused by racism and other forms of discrimination are really well documented, and the pandemic has brought that to light. So, for example, we know that public health factors like a person's socioeconomic environments, the environment they live in, those things shape their health more than any other factor. And those factors are tied to racism. So people who work in essential jobs, and those are disproportionately people of color, people who live in high density housing, again, disproportionately people of color. Those folks are more likely to contract the virus because of unavoidable person to person interactions. And on top of that, people of color and folks in certain socioeconomic groups are less likely to be able to get to quality health care in time.
All very true. So the COVID-19 mortality rate for Black Americans in particular is about 2.3 times higher than the rate of white Americans. So with that in mind and looking at the course of the past year, has the approach to healthcare when dealing with at-risk populations changed at all?
I would like to say in some regards, absolutely. And I think in a good way, the pandemic, the highlighting of these inequities as it relates to access to care and as it relates to how people do when they contract the virus, has dovetailed with the Black Lives Matter movement that really caught a lot of mainstream attention in a way that it hadn't before. And I think that the confluence or the combination of those two occurrences has, at least from my perspective, gotten public health organizations, communities, and even lay people thinking and talking about race and healthcare in a way that I, as a doctor who's been practicing for close to 20 years now, haven't really seen before. So I'm encouraged that there's an inertia that I haven't seen before across healthcare systems collaboratively to try to figure out solutions that don't just help our communities of color get through this pandemic, but hopefully set the stage for really starting to tackle these problems in a long-lasting way once we get through the pandemic.
Now, we're seeing the COVID vaccine become more available to people across the board, but there was that pattern early on where statistics were showing that there were more white Americans getting vaccinated than people of color. And so what approach has Ascension taken in particular to get more people in underserved communities vaccinated?
African Americans in Wisconsin have half the expected vaccination rate so far compared to whites in Wisconsin. And
Right.
that pattern also holds up for Asian American populations and Latinx populations. Now, there's a lot of reasons for that. As I'm sure a lot of us are already aware, there's a lot of inherent bias or reluctance to sort of sign up for public health initiatives that haven't historically benefited peoples of color. There's a lot of reasons that anyone might have reason to mistrust the vaccine now, but I think you're starting to see people realize that the vaccine really does work. It really is safe. It's really not dangerous. And vaccination surveys of people's willingness to get the vaccine are starting to show that I think, irrespective of racial and ethnic lines, I think everyone's sort of on the same page. So, to your point, it's really boiling down to eliminating barriers to getting it. So now we want the vaccine. How do we get it? And Ascension certainly feels called to lead by example. You know, the health system's mission statement is to serve vulnerable populations, and the health system's in a great position to serve in that critical role. So, very specifically, Ascension, as of this week, in conjunction with the CDC in the states, plan to expand vaccination, is going to start rolling out invitations, whether it's through phone, mailings, emails, and really every form of communication that we have for our patients, to open up our vaccine clinics to folks who want that. In addition, recognizing that many folks may not have ready access to phone, email, etc.,
Right.
we're going to start piloting mobile vaccine clinics. The first one to open in the next week or so is going to be down in Racine at a homeless shelter as a pilot. But we're planning to, use that as a way to learn what works, what doesn't work, and we hope to broaden and ramp that up throughout the area. We also have a number of community vaccine clinic locations. Right now, we're trying to focus those where the need is greatest. So focusing on Milwaukee and Racine, there's St. Ben's Clinic, the Ascension Angel of Hope Clinic, the Ebenezer Health Resource Center, and then, of course, our Columbia St. Mary's hospitals, whether it's Milwaukee, Ascension All Saints, and up in Ozaki. We're also trying to partner with community vaccination clinics to try to make sure that our patients get vaccines wherever they can get them. When folks ask what vaccine or where do I go, the answer is whatever vaccine you can get as soon as you can go. So even if you are an Ascension patient or an unaffiliated patient, we're encouraging our patients to really not just seek out resources through our health system, but also to make sure that they're checking in with their county health department. So Milwaukee County patients, for example, has a great phone number and website that folks can go to get information about how to sign up for a vaccine. And by the way, this week's sort of expansion of vaccine access is now allowing folks over the age of 18 to get it. And in Milwaukee County, that's really going to be lined up depending on what zip code you live in. So checking out that information and getting yourself signed out. I know a number of patients of mine who are younger, but who have respiratory disease have been able to get signed up for a vaccine within the next week, thanks to this expansion. So I'm really excited about that, and excited about the work that Ascension's doing here.
Yes, and thank you for all that great information. As we wrap up, Doctor, for those who are still hesitant about getting the vaccine for whatever reason, please, in your opinion, wrap us up telling us why it is so very important to get the vaccination.
Yeah, I understand that there's a lot of understandable fear about the vaccine. It has come out quickly. There's a lot of pressure to do it, and I tend to be someone who, when there's a lot of pressure and something's being rushed, I want to take a step back and make sure that it makes sense. So I get it. And in particular, as I said earlier about our history with the vaccine, particularly among communities of color, even more understandable. But here's a couple of things that people need to remember. These vaccines have been studied in peoples of color and have been shown to be safe. The vaccines currently in greatest use, the Pfizer and Moderna vaccines, were studied in over 40 to 50,000 patients each. And in each of those studies, over 10 to 15,000 patients were people of color. So plenty of good safety data. So far, in the few months that it's been out, there are no concerns really about any kind of significant health impact amongst anybody, let alone folks of color. Um, so the vaccine works. The Pfizer and Moderna vaccines are over 90% effective. The Johnson and Johnson one, as you know, is over 60% effective. Again, all that means is that these are going to keep you from dying, and they're going to keep you from being in the hospital if, God forbid, you get COVID. So they work and they're safe. If you are someone who's young and healthy and you're not worried about getting it yourself, just know that the chances of having something bad happen from COVID are 100 to 1,000 times higher than anything potentially happening to you from getting the vaccine. And if that doesn't do it, well, do it for your family and your loved ones, because the more people that get vaccinated, the safer all of us get. And this is a concept called herd immunity. And what that means is at least half of our population is going to need to get the vaccine before we can feel comfortable about those of us who weren't able to get it potentially being safe. So get it for yourself. It's safer than getting the vaccine. Get it for your family and loved ones.
Thank you so much. Great way to wrap up this conversation. And I really do appreciate your time.
Of course. Thank you for having me.
Dr. J. Balachandran is the chair for hospital specialty medicine at Ascension Columbia St. Mary's. Again, thank you for all your time and all that you do.
Thank you.